I'd like to thank the Healthcare Committee Chair for all of his hard work on this issue over the years. I've really appreciated his mentorship and support in doing this important work. Today, I stand in support of House Bill 2697B as one of its chief sponsors. This bill would provide much-needed relief for not just nurses, but all allied healthcare workers. In the Behavioral Health and Healthcare Committee, we heard stories from workers in many sectors of healthcare about caring for so many patients that it has led to physical and emotional exhaustion. Personally, I know many healthcare workers who've made the painful decision to leave the profession in recent years because they just can't take it anymore. I'm going to speak for a moment as a nurse. Nearly 60% of nurses across the nation say that they have felt unsafe in their practice in the past year. A vast majority of Oregon's nurses have regularly reported that they have suffered moral injury, compassion fatigue, and are just not able to provide quality care due to unsafe staffing levels, impacts on their mental health, and physical exhaustion. The top reasons cited for these feelings of stress, burnout, and being overwhelmed: not having enough staff. House Bill 2697B is not only needed but necessary to ensure that we can retain and recruit healthcare workers. Oregon is facing a hospital staffing crisis, and the heart of the staffing crisis is turnover. This is a work environment crisis as much as it is a staffing crisis. Frontline healthcare workers will not and should not continue working under conditions in which management has not provided enough staff. 80% of our state's nurses have reported that their units are understaffed, and 99% of nurses have said that their units are sometimes or never staffed appropriately. This bill is intended to correct that. I've heard stories from healthcare staff of 18-hour shifts and 22-hour shifts with no opportunity for a bathroom break or to sit down for a meal break. And the data reflects these experiences. Nearly 70% of our state's nurses say they are experiencing severe burnout, with more than 3/4 of them reporting that their work lives are dangerously stressful. House Bill 2697B addresses these concerns and issues with common sense provisions that will require a minimum number of staff on a specific unit in order to provide safe patient care. It gets rid of the buddy system and includes compliance and enforcement mechanisms designed to ensure that safe staffing levels are maintained. This bill is intended to create ironclad protections for meal and rest breaks as well, and it will create serious consequences and monetary penalties for any applicable hospital that does not follow Oregon law. I believe that all Oregonians deserve access to the highest quality health care and heal best when those caring for them are rested. I also believe that Oregon's healthcare workers deserve protection and support for their critical and crucial life-saving services. I urge an aye vote on House Bill 2697B. Thank you.